Today is not for any story, although I'm still gonna tell us a story, but I want us to, especially, I wanna have this discussion with those who are gifted. We are all gifted. It all depends on the gift that you receive from God. But today, I want to talk with those who are gifted with the gift of healing. If you know you have the gift of healing, I will want you to listen to what I've got to say and share my experience with you all. So many of us who are gifted with this gift of healing in particular, we are kind of, I'm not going to say that we're not sure of the gift. We are sure of the gift, but most of the times we don't like making use of it. We prefer using this gift to only those who are close to us, to our family members, the people that know you, the people you trust. We don't like extending it to others, like those we do not know, because you really do not know what people have in mind. You may want to, make use of your gift on someone who is sick, but you really do not know if the person is gonna accept you, accept what you have to offer. You do not know if the next person to that person is gonna accept what you have to offer. So it's kind of a living in bondage for us. Something is being given to you which you're supposed to use on others, but because of human behavior, you cannot use it openly the way you're supposed to use it. And I want to tell us something. I'm going to be honest with us. If you have the gift of healing, and I'm equally talking to myself, if you have the gift of healing, it is better to express that gift at a hospital where you have a lot of sick people. And at the same time, at churches, prayer grounds, where you know a lot of people are going to gather. Those who have come to seek for divine healing, to seek for help. This is where you are supposed to be, like, making use of your gift, letting people know that you have this gift of healing. Now, talking about myself, this is a gift that I realized a very long time ago that I have. But like I said earlier, I prefer using this gift strictly on my family, my siblings, anybody around me, those who know me, not really those who know me, because even those who know me, I really do not want to express these gifts towards them because of human behavior. Not many are going to accept it, although not many are going to reject it. But I want to tell us, if you have this gift and you've not been visiting hospitals, please try as much as possible to be visiting the hospitals so that you make use of your gifts. I'm equally talking to myself. Way back in Nigeria, this gift was it was that's when I would tell you that um I somehow love this gift. Like, I love um making use of it, not as in bragging, but in Nigeria is you have Nigeria has this kind of environment where people accept you and accept what you have to offer. The moment you tell them, "See, I want to do this. Is it okay by you?" Everybody will say yes. Everybody will say yes. But here, you are not even given the opportunity for you to express yourself. Like what you have to offer. But in Nigeria, I remember visiting a lot of hospitals to pray with the sick. And I'm going to give us instances of what God did for those people. I do not know them, but I brought out my time like once in a week to visit hospitals to pray with the sick. And after the prayers, God actually performed miracles. And until I stopped visiting the particular hospital that I always visit, which was close to my house and close to my place of work. So I always stop by at this hospital to pray for the sick before going to work, or sometimes on my way back, I will stop by and pray for them before going home. So there was a particular day that I went to that hospital, and I just noticed one thing that comes with this gift. If God actually wants to heal someone through me, I don't know. I'm not. I don't know if I should say that he is the one that does this, because if I'm gonna pray for a sick person, first of all, I'll fall sick, and it's not a sickness that I can stay at home and take medication and get okay. No, it is a sickness that will take me to the hospital, and then on getting to that hospital, I will pray with the sick, and they will recover. Now I'm gonna give us some instances. When I was seriously sick some years back, this was like around in the year 2014, 2015, I was so sick, like it looked as if I was dying. So I asked my husband to take me to the hospital. And on our way to the hospital, a friend of mine just flashed through my mind, you know, because I haven't seen her in a very long time. And I told my husband that someone just came to my mind right now, and he asked me who the person was. And I told him, and he said, why don't you call her and find out if she's okay? So I called that my friend immediately. She picked the phone. And I told her that she just came to my mind, you know, and I wanted to check up on her. And she told me that as we were speaking, she was in the hospital. She was admitted in the hospital. And I demanded to know the hospital where she was. And she gave me the hospital's name. And it happened that our car just parked in front of that hospital, in front of the hospital. And I asked my husband to just drive in, let me see her. So on getting down from the car with my sick body that was so hot, I walked to the receptionist and told her that I was there to see a patient, and I mentioned her name, and the receptionist refused. She refused to let me in. I pleaded several times, she refused. I turned to walk away, but one mind insisted that I should go back and ask for more. And I went back. I pleaded with the receptionist. I begged. I said everything possible. And after a while, a doctor walked in and asked what the problem was, and I told the doctor. And the doctor asked the receptionist to let me in. And the receptionist allowed me, and I went in. When I went to her room and opened the door, the moment I walked in inside the room, what I saw inside the hospital room was a skeleton lying down on the bed. So, and I just shouted, Jesus. And the skeleton turned to become her. And she asked me what the problem was, and I couldn't tell her what I saw. I just told her that something just struck me. You know, it looked like I felt a sharp pain in me. And then I sat down beside her. She kept on crying, telling me what her problem was and everything, that she was about going in for a surgery the following day. And the doctor, according to her, told her that the surgery is going to be a 50-50 chance. So after saying that, I asked her to stretch out her hands. She did. I held her by the hand, and we started praying. And she equally confirmed that my palms were so hot because I was so sick. And after praying, I left her because I was on my way to my own hospital. And I went and met my doctor, who started the treatment, tests, injections, everything. Do you know what happened? The following day, she was the one to call me on the phone. And I thought she was about going in for a surgery. And she gave me the news that the moment I opened the door and left, that she felt something jumped out from her body. And before evening, she was well, like completely well. Nothing was wrong with her. By the following morning, when she was supposed to go in for the surgery, the doctors decided to run the last test to know what they're actually about to do, an ultrasound and everything. And they couldn't find the reason why they wanted to perform the surgery on her. And she was discharged that morning. And so the husband took the phone and thanked me and this, that. But while they were still thanking me, I was seriously sick. I kept on visiting the doctor, the hospital, until I became okay. Now, another instance was on a day that I was sick and I went to the hospital, and the doctor told me that he was going to admit me. And I said, no, you can't admit me. I'm all alone with the kids. They don't have any other person. If you admit me, no one's going to stay at home with them and take care of them. So he told me that he's gonna like it's gonna be kind of a temporary admission. I will have to come in the morning and go home by evening, and I accepted that for 5 days. So on the first day that I came in, and they had admitted me, and they started the treatment. They started the treatment. What do you call this? The drips, the injections, and everything. I saw a young boy who was almost dying. He was in pains, in severe pains, rolling on the floor, crying, like rolling, wriggling his body. He was in so much pain. And I really do not know what the problem was, but from time to time, the nurse will keep on giving him injection. Like every 10 minutes or 20 minutes, they'll give him another injection. But this guy kept on rolling, and he was sitting beside me because they were preparing a room for him for admission, and they were equally preparing my own. So he was sitting beside me, rolling. And the next thing I saw was he placed his hands on my body, and his hands were so hot. And I came closer to him and I asked him, would you want me to pray for you? He said yes. And he fell on my body. I had to carry him. And I started the prayers. And after the prayers, just like it just happened like magic. Within 30 minutes or 40 minutes, the guy just got up immediately and requested for his phone. They brought his phone for him. He turned on his TikTok page, started watching comedies, started laughing. And the nurses and the patients that were in the room were like, are you for real? Is this a joke? Were you playing pranks before? Were you pretending to be sick before? The guy just looked at them and he didn't say anything. And the nurse came and checked his BP, checked everything, the vital signs and everything, and he was okay. And the nurse got angry and asked him again, were you pretending all along? What is this magic that you're performing now? The guy didn't say anything. So the nurse called the doctor. The doctor checked on him and said that he doesn't need admission anymore, that he's okay. And that was how they discharged him without admitting him anymore, and asked him to come back the following day. And the guy left. And the following day, I came back again, still sick, with a hot body. But this guy just jumped in. Like, when a young guy is running, he just ran inside the hospital, went straight to the receptionist. And the receptionist was like, are you for real? So you just recovered like that? Was it a magic or what? So while the guy was laughing, he turned and looked at me and saw me. He just came straight to me, sat down beside me and said, Auntie, thank you. And I said, no, I wasn't the one. It was Jesus, not me. He said, but you allowed yourself to be used. I said, I don't have any choice. So he got up, went to the nurse, and he was prescribed some medications, and he made the payment, and the medication was given to him, and he left. But I kept on until that 5 days. My sickness kept on until that 5 days. Now, another instance was, this was the one that made me to stop visiting the hospital. I went to that hospital on my way to work. I walked in, greeted the nurses, and told them that I was there to see the patients that I would like to pray for, a few of them, before going to work. So the nurses allowed me. They took me to severe cases, where they had severe cases, They took me to emergency ward. They took me to where people who have no hope anymore. And I prayed with them. So while I was leaving, one of the nurses called me. He told me that there is a patient that she will want me to go and see, even though my time was already up. And I asked her to take me there if they will allow me. She said yes, that she is the one that will allow people, to overstay. And so she took me to that room. And on getting to that room, I saw a woman with her daughter, a teenager. So I thought the woman was pregnant, but she wasn't. So when I asked what the problem was, the daughter told me that the mother has been sick. She doesn't really know what the problem was. She just told me that the mother was sick. It was the mother that told me everything that she was passing through. Her liver was the problem. And I asked her, okay, so what are the doctors doing for you? What did they tell you? She told me that she was kept there, that they are really not doing much for her anymore, that she's just there hoping on God, even though they're still giving her medication. So I decided to pray with her. And before I started, I just got the message that the daughter should place her hands on the mom's stomach while I place my hands on the daughter's stomach, on the daughter's hand. And the reason why is, there are people that you will want to pray with, and they may not like you to touch them directly. And to avoid people saying that you have done something bad to their family member, or maybe that you have transferred an illness to them, or that maybe you've transferred a charm to them, I believe that was why the instruction came, that the daughter should place her hands on the mom's stomach while I place my hand on the daughter's hand. And we started praying. And after the prayers, what else can I do? I asked God to take control. And then we left. Then I came back. This thing happened on a Friday. I didn't visit the hospital again. And I came back on a Monday. And I prayed with the patients. And then I went to her room. She was not there. No other patient was there. That room was vacant. And when I saw that there was nobody there, my heart jumped inside my stomach. I felt terribly bad. Like I felt like crying. I walked up to the nurse and I told her, I was here on a Friday. I prayed with a patient here. What happened? And the nurse said, oh, she's not here anymore. And I said, okay, yeah, I know. I couldn't see her. So what happened? The nurse told me that she was discharged. I said, okay, they don't have money for treatment. Or the nurse told me that surprisingly, the woman got better. Like better. That throughout that weekend, they kept on running tests on her. A lot of things came back to normal. The things she couldn't do, she started doing them well. So by that Monday morning, she was discharged. And she left. And I was so glad. I was so happy. At least, not that she died, but that she was discharged. She left and in good health. Now I came back on a Tuesday to pray for the patients. And I met a different nurse. And this nurse refused that I will come in. I told her I've been visiting this hospital. I've been coming to pray for the sick. She said no, that I should leave. I said, okay, fine. What time will I come back? She said, no, you are not coming back. That she doesn't want any, I was a disturbance to the patients, that the patients needed rest, that when I come, I will start shouting. And I told her, I'm not going to shout. I'm going to pray on a soft tone. I'm not going to disturb any patient. I will pray with the patients one-on-one. The nurse refused. She refused. So when I was leaving, an elderly man held me by the hand on the emergency unit and asked me to just, can I touch her and pray for her? That was all he needed. And I looked at the nurse and the nurse said, madam, please leave. So what I did was just to help that elderly man. And all I could say was, let God take control. That was all I could say. And I walked away. I felt so bad. So because of that, I stopped visiting that hospital. I stopped. Now, coming over to this United States, the whole thing has started again. Like if you have been following my videos, you will notice that I do frequent the hospital from time to time for one thing or the other. But when I go to the hospital, no matter the test that will run on me, they will not see the reason why I was sick, the reason why I visited the hospital. They will not see it here in the United States. But whenever I go there, while sitting down and waiting for them to call me, God will reveal people with worst situations to me. Now, this is where I have a problem, because I cannot walk up to those people to tell them, this is what I've seen about you. This is what God said about you. You know how people behave in this country. You don't just tell them things like that. And I cannot pray with the patients just like that. Some hospitals don't allow it. It is not allowed except when a patient requests that he or she needs prayers. That is the only time that you can pray with a patient. You don't just walk up to a patient and tell the patient that you want to pray with him or her. You don't do that. But all the same, I still want to encourage those of us who have that gift. Please, no matter what, do not stop. Do not stop. I just pray that one day I will have that courage to start it here, because I know that I still visit hospital from time to time for reasons that I cannot tell, for reasons that the hospital staff cannot tell, because no matter the test, the ultrasound, the x-ray, no, nothing, they cannot see anything. But I still visit hospital from time to time because I know that God wants me to start. And that is why He's causing me, allowing me to be sick so that I'll be visiting the hospital for me to start it all over here. But I need that courage from Him. I need it. So I'm going to see us again. Bye-bye.